Hello and welcome. Today we're diving deep into a rare and complex eye condition known as Iridocorneal Endothelial Syndrome, or ICE syndrome. This condition primarily affects the cornea, iris, and the angle between them, often leading to glaucoma and vision loss. Join us as we explore the causes, symptoms, diagnosis, and management of this fascinating, yet challenging disorder. The exact cause of ICE syndrome remains a mystery, but current research points towards a few compelling theories. Viral infections, particularly herpes simplex virus, have been implicated. Genetic factors are also suspected to play a role, although no specific gene has been definitively linked. And finally, some researchers believe that ICE syndrome may arise from abnormal cell migration or proliferation within the eye. It's likely a combination of these factors, and further research is needed to fully understand the underlying etiology. ICE syndrome's impact stems from abnormalities in the corneal endothelial cells, the crucial layer responsible for maintaining corneal clarity. In ICE syndrome, these cells transform and spread abnormally, migrating over the iris and blocking the drainage angle of the eye. This obstruction impedes the outflow of aqueous humor, the fluid that nourishes the eye, leading to increased intraocular pressure and glaucoma. The altered endothelial cells also cause changes in the iris structure, contributing to the various symptoms associated with the condition. ICE syndrome is a relatively rare condition, affecting an estimated 1 in 200,000 people. It typically presents in middle-aged adults, with symptoms usually appearing between the ages of 30 and 50. While it can affect individuals of any ethnicity, some studies suggest a slightly higher prevalence in women compared to men. Due to its rarity and variable presentation, ICE syndrome can sometimes be misdiagnosed, highlighting the importance of awareness among eye care professionals. The signs and symptoms of ICE syndrome are diverse and can vary depending on the specific subtype and severity of the condition. Common symptoms include blurred vision, halo-surround lights, and eye pain. Changes in the iris appearance, such as choroictopia, which is a distorted pupil, and iris atrophy, or thinning of the iris tissue, are also characteristic. Corneal edema, causing a hazy appearance to the cornea, is another potential symptom. Importantly, many individuals may experience no noticeable symptoms in the early stages, making regular eye exams crucial for early detection. Diagnosing ICE syndrome requires a comprehensive eye examination, including a careful assessment of the cornea, iris, and drainage angle. Gonioscopy, a procedure using a special lens to visualize the angle, is essential for identifying angle closure and abnormalities. Specular microscopy allows for detailed examination of the corneal endothelial cells, revealing the characteristic changes associated with ICE syndrome. Intraocular pressure measurement is also crucial for detecting glaucoma. Optical coherence tomography, or OCT, is also helpful for imaging the angle and retina. All of these tests, together, help to give the doctor a clearer picture of the issue. ICE syndrome is typically classified into three main subtypes: Chandler syndrome, progressive iris atrophy, and Cogan-Reese syndrome. Chandler syndrome is characterized primarily by corneal endothelial abnormalities, often leading to corneal edema and glaucoma. Progressive iris atrophy involves significant thinning and distortion of the iris tissue, resulting in choroictopia and polychoria. Cogan-Reese syndrome is distinguished by the presence of pigmented nodules on the iris surface. While each subtype has distinct features, there can be overlap between them, and the classification is primarily based on the predominant clinical findings. Treatment for ICE syndrome focuses on managing the associated complications, particularly glaucoma. Topical glaucoma medications, such as eye drops, are often the first line of treatment to lower intraocular pressure. In cases where medication is insufficient, surgical interventions like trabeculectomy or glaucoma drainage devices may be necessary to create alternative outflow pathways for aqueous humor. Corneal edema can be addressed with hypertonic saline drops or, in severe cases, corneal transplantation. There is no cure for ICE syndrome itself, so treatment focuses on symptom management and preventing further vision loss. Unfortunately, there are currently no known methods to prevent ICE syndrome, given the uncertainty surrounding its underlying causes. However, early detection and management are crucial for minimizing the risk of vision loss. Regular comprehensive eye exams, particularly for individuals with risk factors or a family history of glaucoma, are essential. Prompt attention to any changes in vision or eye appearance can facilitate early diagnosis and intervention, improving the long-term prognosis. The prognosis for individuals with ICE syndrome varies depending on the severity of the condition and the effectiveness of treatment. Early diagnosis and management can significantly slow the progression of glaucoma and preserve vision. However, ICE syndrome is a progressive condition, and ongoing monitoring and treatment are often necessary. Recent research efforts are focused on identifying the underlying causes of ICE syndrome and developing targeted therapies to address the abnormal endothelial cell behavior. Gene therapy and novel drug delivery systems hold promise for future treatment options. It's an area with very limited studies, but a lot of potential.